Well, yeah, CD40, I think over the last, I would say, 20 to 30 years have somehow hold promise for cancer immunotherapy because it's a critical receptor that promotes dendritic cell maturation and also enhances dendritic cells, their capacity to cross-present antigens within the tumor-draining lymph node. And then most recently, we know that dendritic cells are also critical not only at priming T cells, but also they can potentially be critical in sustaining T cell anti-tumor immunity within the tumor microenvironment. So it's been known that agonizing this pathway using antibodies could be potentially a complementary approach to current immunotherapies that are mostly centric on T cell reinvigoration. So from that end, I think that really agonizing CD40 pathways in dendritic cells potentially could be pretty promising for cancer immunotherapy. But and this has been proven preclinically in many cancer models, showing how antibodies that agonize this pathway really promote this T cell anti-tumor immunity, promotes dendritic cell activation, and initially there was a lot of excitement about these therapies, but unfortunately, when these therapies have been translated into the clinic, it hasn't been quite successful. So as you can imagine, when you prime these dendritic cells, you're really promoting significant an insignificant inflammatory response. And what we've seen with some of these first generation antibodies was significant side effects such as cytokine release syndrome. Also the expression of CD40 on cells such as platelets led to significant thrombocytopenia, also really bad liver toxicity that made most of these trials actually failed at early stages. And here at the lab, I think I would say over the last 10 years, the lab has focused on really understanding the mechanisms of action of these therapies. So what we discovered, the Ravage lab discovered, was that the back end of these antibodies, the Fc domain, it's critical for the anti-tumor activity of these antibodies. So, for instance, first, and specifically the interaction between the Fc domain with the inhibitory receptor FcγRIIB.